Cleveland Clinic is looking to become the city's third Level 1 trauma center. We talked about this last night. And since then, we've heard from other healthcare systems in the area, some expressing concern. Metro Health says it is alarmed for our community and calls on the Cleveland Clinic to reevaluate its plans. Like similarly sized metropolitan areas, Greater Cleveland cannot sustain 3 Level 1 trauma centers. It will harm patient outcomes and increase costs for the entire community. University Hospitals tells News 5 it hopes to work together across Level 1 trauma providers to allow the community the best care. And Cleveland EMS says multiple care options are a positive for both residents and visitors. We all know that Level 1 trauma centers treat gunshot victims, according to Ohio EMS data from 2023. Roughly 471 gunshot patients arrived at Cuyahoga County hospitals. Tonight, a state lawmaker is also sounding the alarm about Cleveland Clinic's plan he calls a clinic policy to detain people who bring gunshot victims to their ER unconstitutional. News 5 investigator Sarah Buduson spoke with Darnell Brewer. Sarah here now with more.
Rob, it all started last spring and was brought to light in a December story by Signal Cleveland. Brewer was at the hospital when he stumbled upon a scene involving Cleveland Clinic police, which made him question how the clinic treats people who are just trying to help. We want to warn you, this video may be hard to watch. This body camera video shows what Darnell Brewer witnessed in person.
He wasn't outside my car, man. He wasn't outside my car. I wasn't even Can you give me my keys? No. Can you give me my keys? No. I wasn't shot.
I need your ID right now.
Cleveland Clinic police handcuffed and detained Ibrahim Alim outside the emergency room at their main campus last May. The only reason the person Alim drove to their ER had a gunshot wound.
Oh, it's tripping, man. Come on, man, brother. You gonna let them do this, man? Okay, man. You gonna let them do this to me, brother? Brother, what is they doing? All right, just relax.
Brewer was at the hospital to visit his mom when he saw police take Alim to the ground.
He was immediately, accosted by the Cleveland police. His, keys were taken out the car. He was detained, put inside of a car, unprovoked, without even asking questions.
So he started asking questions. It turns out it is the Cleveland Clinic's policy to detain any person who's with a gunshot victim. The clinic says the policy was developed in response to a rise in violence at their emergency departments and is not meant to discourage people from bringing patients to the hospital.
Is that constitutional? Can they do that?
And speaking to some of the scholars, speaking to some of the lawyers, I don't believe it's constitutional. They don't believe it's constitutional. And it's something that definitely needs to be addressed.
Brewer also questions whether there is a need for another trauma center. There are already 3 in Northeast Ohio. He also wants to know how the Cleveland Clinic would staff the facility, how it would impact EMS routes, and what would happen to patients who can't afford to pay.
Maybe they have some data that I don't see. They need to share that data. And looking at the stats, I believe that those 3 hospital systems are doing some of the best things, some of the best work already. So why do we need to expand?
Brewer says he hasn't received a response from the Cleveland Clinic about his concerns. We reached out to the Cleveland Clinic today with similar questions. We also haven't received a response. Rob?
We know you'll stay on it, Sarah. Thank you so much.